fatigue is really the number one symptom across the board, just ongoing fatigue. And then brain fog is another one, which is just inflammation of the brain. Pain tends to increase in these patients, so they'll have ongoing pain syndromes. They'll have brain issues like memory, inability to recall, impaired learning, things like that. And then they might have some cardiovascular issues because the heart's inflamed. So there might be some heart arrhythmias, POTS, which is just basically a problem with the heart from lying down to standing, skin issues, autoimmunity, loss of muscle mass. There's, like you said, there's many over 60 symptoms now. People can have gut issues as well. It can manifest thyroid, menstrual cycle issues. So there's a lot there to unpack.
And it's important. This is not my area of expertise, but what is my area of expertise are in the hormone realm. And so what I'm seeing from that is that people are brushing some of these symptoms under the rug of, oh, it's quote, just my menopause, or it's quote, just the stress I'm under right now, or something else that's happening in their life, when in fact, maybe they just don't realize that long haul COVID syndrome could be a component of that.
Mm-hmm. Exactly. Yeah. Some people will just have one, ongoing symptom for a long time. They might just be more tired for a year or longer. I mean, that's considered long COVID. A lot of the women have their menstrual cycles have just completely flipped. I've seen a lot of patients who have that completely changed. And sleep issues are also another big one. Some patients might just have ongoing sleep issues, and they might just chalk it up to, the daily stresses of life and things like that. So it's definitely, not something to overlook, even if you just have one symptom that's ongoing.
Dr. Nik, welcome to the Root Cause Medicine podcast. I'm excited to talk to you today.
I'm excited to be here. Thanks for having me.
Well, I'm most excited, one, because I just love talking to you. I have been on your podcast and we have been friends for a while, but two, we're going to talk about COVID, long haul COVID for patients. And you have a lot of experience with this, and I haven't had anybody on the podcast yet to talk about it, but yet I know it's a super important topic. In fact, yesterday, I'd read on the CDC website, I think that the average person with long haul COVID has like 16 or 17 symptoms. And then this morning I read on a different site that there's 62 symptoms out there. And I thought, oh my gosh, perfect timing. So we can walk through this for people.
Mm-hmm.
Yeah.
Right. Yeah, it's a big problem. The latest research that I've read, it's getting close to about 40% of people who have had COVID, they have some kind of lingering symptom past 6 months.
Mm-hmm.
And it doesn't seem to matter how severe their case of COVID was, whether they were hospitalized or even just a mild case, they might end up with long COVID that lasts, 6 months, 18 months. So that doesn't seem to matter either.
And in some of my friends, one of my best friends had a mild case of COVID and lost his smell and his still predominant and taste, and still is predominantly lost his taste and smell. I think he said he can taste sweet. He can taste lemons. Like there's just a tiny few things that he can actually really taste. And otherwise he said it's pretty gross. And he just had a mild case. So that fits perfectly. Well, actually, before we get started though, what people don't know who you are. So let's do a quick introduction of who you are, what you do, what your background is, what you stand for.
Yeah, well, I've been practicing functional medicine for 20 years, mostly focused on autoimmune disease and thyroid, Hashimoto's. That's been the bulk of my practice. And I also have an online functional medicine education platform for practitioners called the Hedberg Institute. And so I've been training practitioners in functional medicine for about 10 years. And, I'm pretty much, mostly research based. I spend most of my time reading papers and trying to apply that clinically.
Which is what we're doing today. So for those who don't know, what is long haul COVID?
Right. So there's various hypotheses actually about it, what it is, what causes it, the different mechanisms. And, they have the post-acute COVID, which is up to 12 weeks, and then they consider the long haul beyond 12 weeks. So they're trying to classify it. But there's overlaps with things like chronic fatigue syndrome, myalgic encephalomyelitis. But the main things that they're classifying are organ damage, could be persistent viral antigen. So there's still viral RNA in the body. There's just a few studies on that regarding the lung and the gut. And then there's ongoing inflammation. There's herpes virus reactivation, like Epstein-Barr virus, herpes 6, cytomegalovirus. There's potential autoimmune mechanisms. There's immunometabolic abnormalities. There's endothelial damage to the microvasculature. And so those are the main components that they're talking about now in the literature as far as the pathophysiology.
And for the layperson who's listening, what are those signs and symptoms? How does that translate to somebody listening who's going, I don't know if I have long COVID, but I suspect it, or I don't think I do, but oh my goodness, I actually have those symptoms.
Right. Yeah, fatigue is really the number one symptom across the board, just ongoing fatigue. And then brain fog is another one, which is just inflammation of the brain. Pain tends to increase in these patients, so they'll have ongoing pain syndromes. They'll have brain issues like memory, inability to recall, impaired learning, things like that. And then they might have some cardiovascular issues because the heart's inflamed. So there might be some heart arrhythmias, POTS, which is just basically a problem with the heart from lying down to standing, skin issues, autoimmunity, loss of muscle mass. There's, like you said, there's many over 60 symptoms now. People can have gut issues as well. It can manifest thyroid, menstrual cycle issues. So there's a lot there to unpack.
And it's important. This is not my area of expertise, but what is my area of expertise are in the hormone realm. And so what I'm seeing from that is that people are brushing some of these symptoms under the rug of, oh, it's quote, just my menopause, or it's quote, just the stress I'm under right now, or something else that's happening in their life, when in fact, maybe they just don't realize that long haul COVID syndrome could be a component of that.
Mm-hmm. Exactly. Yeah. Some people will just have one, ongoing symptom for a long time. They might just be more tired for a year or longer. I mean, that's considered long COVID. A lot of the women have their menstrual cycles have just completely flipped. I've seen a lot of patients who have that completely changed. And sleep issues are also another big one. Some patients might just have ongoing sleep issues, and they might just chalk it up to, the daily stresses of life and things like that. So it's definitely, not something to overlook, even if you just have one symptom that's ongoing.
Is there a test? Like if somebody's listening to this and they're thinking, I think I have long COVID, is there some sort of test they can do, or is it basically signs and symptoms ever since they've had COVID?
Yeah, that's a really good question. And there's a little bit of controversy there because there are a few labs out there that are specifically running what are called long COVID panels. And these are mainly cytokine panels. And this is where the controversy comes in because cytokine testing is highly ambiguous, and there's controversy about how accurate those results are.
Can you explain what a cytokine is?
Yeah, cytokine is just a chemical made in the body uh, by the immune system. And so it's a way that the immune system communicates basically with itself within the body. And so a cytokine can drive inflammation. It can support the immune system. It can suppress the immune system. It can cause autoimmunity, and they're pretty much involved in all of the symptoms that people are feeling.
But yet the testing you were saying is on the controversial side.
It is, yeah, it is somewhat controversial. The labs stand by their results, obviously, and then there are scientists who are critical of these results, but they are finding particular patterns. So you will see, even on just conventional labs, looking at they're called CD4 and CD8 T cells, looking at the T cells in the body. Those are the lymphocytes. Those are definitely abnormal. Those are found in the literature to be abnormal in long COVID. So there's basically an immune exhaustion. The T cells that fight viruses are just kind of being wiped out. They just tank and they don't really recover. But at the same time, some of them are producing inflammatory compounds. So the immune system gets wiped out, but there's still inflammation driving consistently in the body,
resulting in the ongoing symptoms, these long
right?
symptoms. In
Yeah.
your practice specifically, how often are you seeing long COVID? If you had to put a percentage to it, what would you guess?
A percentage of people who get COVID and then they develop long COVID.
Yeah.
Yeah, I mean, from what I'm seeing, it's somewhere around 20%. So when you look at the literature, they have a range, somewhere around 18 to 40%, somewhere in there.
Do most people by now, just given the news and social media and whatnot, have an idea of long COVID, or do they come into you saying, I'm so tired and I don't think my brain's functioning, and you're the one who's having to point out, you realize that's been ever since you've had COVID?
Yeah, I would say about half are aware, and then the other half, kind of a light bulb goes off. And like one example is you can get long COVID also from the vaccine, not just the virus. And so I have had a few patients get long COVID from the vaccine. And I kind of put the pieces together there because one of them got shingles, and that's actually a common, herpes reactivation, not just from the virus, but from the vaccine as well. So there is awareness for sure.
Yeah. I have a colleague. She's a doctor on the East Coast. She got her first COVID shot and developed herpes came roaring back. And then I have another doctor who was on the front lines, got her COVID vaccine and developed POTS, the postural orthostatic tachycardia syndrome. So that was right away. That was the thing. And the herpes resolved rather typically. The POTS took months and months to finally start to improve. And that was just from the vaccine, not the actual infection.
Yeah, what the doctors that I know are finding, and what I'm seeing, is that those who do get long COVID from the vaccine, they do recover much more quickly than those who get long COVID from the virus itself. And the main difference between the two is that the symptoms from the vaccine tend to be a little bit more neurological, and then the symptoms from the virus in long COVID tend to be not just neurological, but the rest of the body.
Do you tend to see in your patient base other underlying issues or genetics that you know about that might predispose someone to developing these symptoms, either post-vaccine or post-COVID infection?
Yeah, definitely. These are patients who, a lot of them, they have already had somewhat of a compromised immune system ongoing. They usually already dealt with an autoimmune condition, or they've had chronic fatigue. Maybe not, full blown chronic fatigue, myalgic encephalomyelitis, but they might have just had, ongoing fatigue for a long time. A lot of them have had gut issues, and then they tend to have high adverse childhood experiences scores.
Mm.
So a lot of childhood trauma, and the higher the ACE score, the higher the inflammatory cytokines. People just tend to be more inflamed as adults, and their immune systems tend to over respond to things like infections and vaccines if they have a lot of adverse childhood experiences.
Yeah, and I think, unfortunately, that's really common,
Mm-hmm.
right? Really
Yeah.
common. And it doesn't get talked to. I was talking to another practitioner yesterday about adverse childhood events, what we call ACEs, and how it doesn't typically get talked about in the everyday medical visit. Maybe you talk about it with your therapist or your counselor, or maybe you don't. But if you're going in to talk about your fatigue or your gut issues, your gas, bloating, constipation, diarrhea, your autoimmunity, it's not generally something your rheumatologist or endocrinologist or gastroenterologist is going to say. Tell me about your childhood. Tell me about things like that. It's right to the symptom, and let's snuff it out somehow.
Right.
So this is really interesting. This is really interesting. And I think more data will probably come out as we get further and further in the years about this.
That's right. And also along those lines is loneliness and social isolation. The metabolic and the immune effects, the hormonal effects of social isolation and feeling of loneliness is another thing that's drastically overlooked. And the consequences to the body are profound. And unfortunately, during the pandemic, there was increased feelings of loneliness due to social isolation. And so that also had a major impact on how the body was responding to the virus and the vaccine.
Which makes total sense to you and me. I mean, they've talked about loneliness in cardiovascular disease, right? Even just your risk for heart disease. We know that lack of community and feelings of loneliness right there increases risk, heart attack, stroke, etc. And through the pandemic, I had a number of people in my comments, in my DMs, who repeatedly said that they were stuck at home, they lived alone, they'd lost their access to their community. They weren't going to work, they weren't allowed to meet up with friends or family or travel, and it was taking a massive toll. Of course, at the time they're thinking mental health, but as you and I know, it's a system-wide effect when you're lonely, when you're feeling lose your community and you're feeling lonely.
That's right. And there was even research previously on elderly who are lonely. The efficacy of the flu vaccine is significantly reduced if they're lonely. So there's impacts there. And then also they found that the more lonely you are, the higher your Epstein-Barr virus titers go. And then they drop when your feelings of loneliness improve.
So actually, speaking of Epstein-Barr, one of the things I wanted to circle back to was chronic fatigue. Can you explain what chronic fatigue is to listeners? Can you explain some of the mechanisms behind it? Epstein-Barr, can you tie that together?
Right. Yeah. So chronic fatigue syndrome, also known as myalgic encephalomyelitis, it's a very complex disorder, and even in the literature, there isn't a consensus on what causes it. There's a lot of different theories, just like with long COVID. But essentially, patients are extremely fatigued. They have exercise intolerance, so maybe even just going for a walk around the neighborhood wipes them out for a day or two. And so there's major issues with their metabolism and their immune systems. And so there's different kind of theories like the mitochondria. These are the parts of the cell that make energy. So they found that these particular patients have issues with the mitochondria. And then some of them have herpes virus reactivations, like you just mentioned, Epstein-Barr, cytomegalovirus, herpes 6. So that's another aspect. And then also the microcirculation, which is damaged by COVID, but also there are circulation issues, especially in the brain of people with chronic fatigue. And so it's really difficult to treat and to understand, but it's getting a lot more focus now because of long COVID.
It's interesting when I've been I'm not quite 20 years. I'm 17 years out in practice, but I remember years ago you'd bring up chronic fatigue and just the eye rolls in conventional medicine, like, oh, that doesn't exist. There's no such thing. Epstein-Barr causes mono, but like nothing beyond that, herpes 6, nobody cares about it. And now when you search, in fact, just yesterday, I think on the CDC website, even, I mean, they had a whole section about chronic fatigue and ME and et cetera, et cetera. And I don't like this from, that COVID had to bring it about, but I do like that it's finally getting a lot more recognition for people who got blown off for years.
Exactly. Yeah. So there's more and more papers coming out on it recently. And a lot of those papers, they mention chronic fatigue and long COVID in the same light because there's so many similarities there. And if you look at the immune profiles of these patients, they look very similar. So whether it's the vaccine or the virus itself, there's no doubt at this point that can trigger a chronic fatigue syndrome like presentation.
If somebody did nothing about it, not a thing of their long COVID symptoms, would they fully recover? Or is it at this point, do we just not know?
Yeah, I mean, some people fully recover not doing anything for certain. And the problem is that the papers that have just come out recently on this is that even the people who are recovered, they're seeing 12 months later, they still have compromised immune function. And so some of the hypotheses are that we're going to see increased rates of cancer because their innate immunity has been wiped out for so long. And you have to have that to gobble up malignant cells that are beginning to turn into cancer cells. So that's a potential issue. So even those who have recovered, we may see, some ongoing issues there later on.
Or even, correct me if I'm wrong, but even if you feel better and recovered, if your immune system is still struggling, not only cancer, which is potentially a worse case, but you're even just more at risk for other infections, correct? Getting sick from other things because you just don't have the defenses like you used to.
That's right. And they do mention that in the papers, more likely to, get the flu and have a difficult case. And then they also mention HIV. So people who already have that, even though we have really good, HIV drugs, they talk about those patients potentially having some long-term issues because of the compromised immune system.
Yeah. Wow. Okay. So treatment, what are you seeing conventionally? What is like sort of the conventional, traditional treatment if you walked into an urgent care or you saw your, primary cares? Or is there anything out there? Are they doing anything?
No, I mean, they're not really doing anything. Conventional approach to long COVID, rest, drink some extra water, just things that aren't really going to do a whole lot, unfortunately.
Okay, so that's a bummer. Damn it. But now they come to see you. These are the patients that are in your practice. First of all, they come in, they're presenting with symptoms. What are some of your go-to tests that you start with? Obviously, this is everybody's different. There's 60 plus symptoms. So that way, workup's going to be different. But if somebody's listening to this going, crap, that's me, I'm having some of these symptoms. I went to the urgent care who said, rest, drink water, good luck, give it 12 months. What are some things you do for workup?
Yeah. So I'm only doing 2 tests.
Oh,
And that,
easy.
yeah. Yeah, you don't really need more than that.
Mhm,
So you need, and when I say two, I mean I do a full comprehensive blood panel, traditional, through LabCorp,
mhm.
looking at thyroid and iron.
No,
Uh,
no, I got to stop you there though. When you say thyroid, you don't just mean TSH.
right. Yeah.
Yeah.
Free T4 and free T3, because they are finding low T3 syndromes in these patients. And then iron, lipids, liver, kidneys, CBC, all that stuff. And then I might just add in a few other things, like I might just want to see if their Epstein-Barr virus titers are high, so I'll look at that. And then I do one panel. It's called a T and B lymphocyte natural killer cell panel, which gives me those numbers on the CD4, CD8 T cells, natural killer cells. I just like to see if those are still compromised, wiped out. And then the other one is just a really good stool analysis, because there are a few papers out now showing that these patients have gut dysbiosis, and they tend to have elevated pathogenic bacteria, and then lower beneficial bacteria, especially bifidobacter, is found to be wiped out
Mm.
in these patients. And then I just want to see if they have other pathogens that are compromising their immune system and driving inflammation. But that's basically it. I don't do more than that.
No, that's great. And so the blood test, what I love that you said is it's just conventional, LabCorp, Quest, your
Mm-hmm.
hospital, whatever you do or your doctor does for blood draws, it's it's not fancy. It doesn't require um specialty testing, so to speak, that we're familiar with. However, the stool test, I do want to clarify, you're not just talking about an ova and parasite that you would send to something like LabCorp. You're talking about something much more in-depth and specialty.
Yeah, I mean, I like the GI map from Diagnostic Solutions, and that gives us a really good view of all the bacteria, H. pylori, parasites, fungi, viruses, and then just the intestinal health. So I can see the strength of the digestion and the immune system in the gut. So yeah, it's a combination of like a functional view of the gut, and then also a pathogenic view, looking for infections.
And patients are, in my experience, I have to hype them up for it because I'm like, you get to poop in a cup for science. Stool
Right.
testing is exactly what you think it is. And there are, I do want to shout out, there are other labs, because maybe your practitioner uses somebody different. So there's a company called Genova and they run a GIFX. There's a company called Doctors Data. They run the GI 360. There's a company called Microbiome. They run Biome FX. So there are other great in-depth stool analysis companies out there, but GI Map is a really
Mm-hmm.
popular one
Mm-hmm.
by Diagnostic Solutions.
Right.
And I don't,
Right.
can you talk about the immune system in the gut? I think people forget it's pretty heavy down there.
Yeah, I mean, that's the bulk of the immune system. Depending on what you read, 60 to 80% of the immune system's in the gut. And it's going to intimately regulate what's going on in the brain. And a lot of patients have brain issues. And then there's connections there with the gut and the rest of the body, the mood, depression, anxiety, energy levels. It's one of those things where no matter what you're talking about, what condition you're talking about, you can always talk about the gut, will be connected to it in some way or another.
Which in that gut, what we call the gut brain axis, I'm so excited that it's getting so much press in the literature, because in fact, I had Dr. Robert Hedaya on the podcast, and we were talking about how patients, depression, anxiety, brain fog, worsening bipolar, etc., and gut, how it can connect to the gut. We would think it's so far away and he makes the joke. He says the head is connected to the rest of the body by this thing called the neck, and then of course we go deeper and mean the vagus nerve. And can you explain that gut-brain axis and how somebody might look at you crazy and go, what? I have brain fog. Why do you care about my gut health?
Right. Yeah. So, there's something called leaky gut,
Mhm.
and that drives inflammation in the rest of the body and the brain. And the bacteria in the gut regulate our adrenaline, our neurotransmitters, there are connections there. And the bacteria in the gut, depending on what you're eating and the health of your gut, they produce a compound called lipopolysaccharides. And those are highly inflammatory, and that can cause the symptoms of brain fog and memory loss and mood disturbances and things like that. And the
It,
vagus nerve, uh, that's kind of a big topic, so we could talk about that in a bit.
which actually, okay, so we move into, now that you've done testing on them, let's talk treatment.
Mm-hmm.
Let's talk treatment. What are you discussing with your patients?
Yeah, so I'll tell you what I've found. I've got a good base, protocol put together, and we always want to do, the least expensive, most effective things that aren't going to overwhelm people. But one of the things that most effective is intermittent fasting, and so fasting is going to help to metabolize problematic cells, I think is the best way to put it. And so we'll do usually we have the first meal anywhere from 10 to 12 a.m. And then there's usually about an 8 to 10 hour feeding window. So they might just eat lunch and dinner, or they might have lunch and then maybe like a protein shake in the middle of the afternoon and then dinner. And so fasting actually helps a lot. And then some people will just do better with different fasting regimens. Like they might eat breakfast, but then they might not eat again until dinner and things like that. So that's a long window where the body is fasting, and that helps to bring down the inflammation. And that seems to be working really well for these patients. So as far as diet goes, we do the fasting, and then we look at the diet for potential food sensitivities, anything that drives inflammation. And so we'll usually just start with gluten-free, dairy-free, sugar-free. We just do those three for the first month plus the fasting, and you're going to get really good results bringing inflammation down. And then there's significant overlap with mast cell activation and histamine. And a lot of people are on low histamine diets with long COVID getting good results. So we'll also do a review of their diet and see if they're eating a lot of histaminic foods and bring those down in the diet. And that helps quite a bit.
Can you give us some examples of histaminic foods just for people to understand?
Yeah. Well, the gluten containing grains are histaminic, and so are dairy. Those are histaminic. And then it varies within the fruits and vegetables. Like avocados are actually histaminic, even though they're seen as a health food. Tomatoes are histaminic. Some people eat a lot of berries, not knowing that raspberries and strawberries are histaminic, but blueberries and blackberries aren't. Fermented foods are actually histaminic. So kimchi, sauerkraut, pickles, things like that, those can be histaminic. And then things like packaged processed foods tend to be more histaminic. So I have a whole histamine diet put together for patients.
What about alcohol?
Yeah, alcohol. Yeah, cider, wine, beer, those are all histaminic. Distilled spirits, not as much, but alcohol by itself is going to be histaminic.
And in general, probably just not great for your immune system and
That's
recovery.
right. Yeah, exactly. Mm-hmm.
Okay. All right. So we have intermittent fasting. We have reducing inflammation through diet. Do you have other parts of your sort of your baseline that you talk to people about?
Yeah, I mean, other than diet, one of the big things is vagus nerve stimulation. So there are a number of papers now out on how COVID affects the vagus nerve. It actually gets into the brainstem, into the dorsal motor vagal nucleus, and disrupts vagal motor outflow. And so basically the vagus nerve is a big anti-inflammatory nerve. So a lot of people think of it as like a calming nerve, but it's really not. It is important for digestion, but it inhibits inflammation, and then it increases acetylcholine, which is a compound that really helps with the brain fog and the memory issues and energy and things like that. And so the vagus nerve stimulation, I give patients a handout. It just tells them you can do like singing, humming, gargling with water, walking in nature, yoga, Tai Chi, meditation. Those all kind of stimulate the vagus nerve. And then there's various electrical devices that can be used. You can use a TENS unit with an ear clip on the left ear, and that stimulates the vagus. And then more recently, I've been using this. It's called a gamma core.
Yeah. I just learned about that.
Yeah, it stimulates the vagus nerve chain on both sides of the neck, and it gives a more robust stimulation of the vagus nerve. And so that's another big thing we get them doing is vagus nerve activation, stimulation.
Can you just explain briefly, like, why does humming, gargling, singing, why do these things help the vagus nerve?
Well, it's because of the vicinity, the vagus nerve in that area of the throat. Singing, humming, gargling, that activates the vagus. And just really anything pleasurable. I mean, even just eating stimulates the vagus nerve. Sexual intercourse, masturbation stimulates the vagus nerve. Pretty much anything pleasurable.
I've even read, I don't know that I've read papers on this, but I feel like I've read it in books, circling back to loneliness or not lack of community, but being in community, like feeling safe, having a good time, laughing, real laughing with your community. Would you also include something like that?
Yeah, I do. That's part of the loneliness discussion, because a lot of these patients tend to be a little bit more isolated. So I just talk to them about, even if it's just one friend, try and get out, go have lunch or dinner. Are there any groups that you like that you could join where, you can do fun things together, hiking groups, whatever the person is interested in. But yeah, they need to be around people, because the more people you're around, the stronger the safety signal to the body. And the safer you feel, the more the vagus nerve is activated in a healthy way.
Yeah. Yeah. All right. So we have the foods, we have the vagus nerve, we're reducing inflammation. Do you ever add in supplements or nutrients?
Yeah. So, normally I always try to be as minimal as possible with supplementation. But the fact of the matter is, with chronic fatigue syndrome patients or long COVID patients, they're going to be on a lot of supplements. It's just necessary because it's such a complex issue. So some of the big things are going to be probiotics, because of the research that shows these patients have dysbiosis, and probiotics are just so good at restoring immune function, and these patients have abnormal immune function. So use a probiotic, and then we want them on something that's going to increase muscle mass. And this is something that I think a lot of people are overlooking in their protocols. But there's a lot of literature out on sarcopenia, which is the loss of muscle mass in long COVID, because they get COVID and then they're not exercising, and then they get sick and they stay sick and they're so tired they can't exercise. And if you lose muscle mass, you become more inflamed and you become more insulin resistant, because muscle is really an organ in and of itself. It's one of our best anti-inflammatories. And so we'll use an amino acid powder to avoid any potential allergens to like whey, pea, rice, anything like that. And the amino acids have been shown to increase lean muscle mass without even exercising. And so this is another really important supplement that I'll use. And then there's kind of a big list. We can work our way through them. Some of the obvious things like vitamin D are going to be important. Mm-hmm. And then there is one study out now on adrenal adaptogens and long COVID. And They found that the combination of Schisandra, rhodiola, and eleuthero was effective at improving long COVID symptoms. So those three work quite well. Adaptogens, basically, they improve the body's resilience to stress, and they also help to restore immune system function. So they're going to help people with energy and mood and their brain function and their immune system and things like that. So there's more we can go through.
Well, and actually my only hesitation is that, as people will write down the list and then they will just run. Yeah, they will just run to the online or the big box stores and buy whatever they see, because understandably they're desperate and they don't feel good. So let's do it by category. We talked about, adaptogens. Do you antioxidants? Do you use antioxidants?
Yeah, definitely antioxidants. Some of those also reduce histamine. They're effective for mast cell activation. So antioxidants are definitely important. You want to improve glutathione levels. So there was a paper recently it's the first genetic study on people with long COVID. And they found that those with long COVID compared to controls, they do have higher rates of glutathione SNPs, glutathione transferase and peroxidase. Mm-hmm. And they actually already knew that people who have severe COVID, the disease itself, do have lower glutathione levels. And this study confirmed a genetic connection with lower glutathione. So anything you can do to boost glutathione is really important.
Can you explain for those who don't know what glutathione is?
Yeah, it's really the body's, I guess you could say it's the body's most important antioxidant. So it's everywhere. It's in every cell. It reduces inflammation. It helps to restore immune system function. And it's important for detoxification, and it's important for the gut and the brain. Kind of everything. Mm-hmm. And you can just take, glutathione, and there's also various supplements that improve glutathione levels.
Yeah. What about melatonin? Melatonin's my favorite antioxidant, mostly because melatonin is so old. It's billions of years old. So I'm always like, she's a queen. She's seen a lot of things.
Right. Yeah, I have that on my list here. Melatonin, as you said, it's a great antioxidant. So these patients have impaired innate immunity, and melatonin helps innate immunity. And then also, a lot of people don't know that melatonin it's a good antihistamine in the brain. And so with these patients who have these mast cell activation like symptoms, melatonin is going to be perfect for that. And they tend to have sleep issues, so it's going to be helpful for that as well.
I did not know that melatonin had antihistamine properties in the brain. Mm-hmm. That's fascinating. Okay, and I'm assuming another category besides probiotics is likely gut. If you've come across pathogens or bad bacteria, so to speak.
Yeah, so so mostly using probiotics for the gut, and a lot of them have, like I said, they have low bifidobacter. So I will mention another supplement. So slippery elm is a great herb to improve bifidobacter levels. And some people who take prebiotics, they have problems. They get a lot of gas, cramping, bloating, things like that. Slippery elm, as long as it's in a low enough dose, doesn't tend to cause that like other prebiotics. And it also helps to heal the gut. So that's another gut one I'll use. And if they do have pathogens, we'll use some herbal antimicrobials,
Mhm.
and then other compounds to help heal the gut barrier.
And then as another category, we keep talking about it, but histamine, do you have a specific, if that seems pretty clear in the person in front of you, are you looking at specific
Mhm.
antihistamine support?
Yeah, yeah. So the low histamine diet is actually going to be the most effective for that, but flavonoids and flavanols help to reduce histamine. So the combination of vitamin C and quercetin is a good basic, supplement stack for high histamine levels, and there are a few more than that, but that's a good start.
And vitamin C being also, as we know, a great antioxidant. It's important for our
Hmm.
adrenal glands, so stress response. And it helps glutathione recycle
Hmm.
so it can do its thing. So vitamin C. And
Yes.
I talk about this a lot. It still blows my mind. Humans cannot make their own vitamin C. If you look up online about vitamin C, they always quote this goat study that just cracks me up, that researchers got funding to study stressed out goats. God bless them. And realize when
Hmm.
goats get stressed out, their vitamin C production goes up exponentially to help combat that. And I thought,
Hmm.
how come goats have that, but humans don't? We could really use that right now.
That's right.
We need to bring that back.
Yeah, and I can give a few just things in the kitchen that
Yeah.
that people can use to reduce histamine and improve their symptoms. So one thing I have most people do is drink ginger tea, and so you just take a thumb size portion of fresh ginger, grate it, and then steep it for 10 minutes with boiling water. And ginger is a good antihistamine. It's a good anti-inflammatory, and it's good for the microcirculation, which is damaged by the virus. And the microcirculation is another big one that we need to talk about as far as
Mm.
supplements and
Hmm.
strategies, because the blood vessels are damaged by this virus. So I do the ginger and then garlic, just like a half to one clove a day. Crush it, mince it, let it sit for at least 10 minutes to activate the allicin, the health benefits. And so consuming garlic is also going to be very helpful.
Can you cook that, or do you
Yeah,
recommend
cook it,
raw?
cook it.
Okay.
Yeah,
People are thinking,
don't
oh
eat it
no.
raw.
Okay, and then
Cook it up.
let's get into the microcirculation. What do you mean by microcirculation for people?
Yeah. So microcirculation is basically all the small blood vessels that go to every organ in the entire body. I mean, it's everywhere. And so any kind of chronic illness, whether it's long COVID or anything, needs microcirculation support. So I'll go through my list here of things that people can do to improve microcirculation. So number one, increase consumption of green leafy vegetables.
Mhm.
And then number two, 20 grams a day of dark chocolate.
Oh
Uh,
no. Doctor's orders.
so you want to look for about 85 to 92% cacao.
That's my favorite.
And a couple of caveats. Number one, chocolate is histaminic, so not everyone's going to be able to tolerate it. And then it does have caffeine in it. So if histamine is a problem and caffeine is a problem, then you want to avoid the dark chocolate. But if you can tolerate it, it's really good. Cocoa dark chocolate is actually very effective in chronic fatigue syndrome and also microcirculation issues.
People listening are going, I don't care if I can't tolerate it. I'm
Yeah.
having, she said 20 grams of dark chocolate. It's therapeutic.
Right. The next one is increased consumption of like blueberries, blackberries, strawberries, raspberries. Um, Use more herbs and spices like turmeric and ginger. We talked about the ginger tea. And then drink 3 to 4 cups a day of green tea. This can be caffeinated or decaffeinated. This has compounds in it that are really good for the microcirculation. And then beetroot juice or a beetroot supplement, like about 200 milliliters a day of beetroot juice, really helps to open up the blood vessels. It increases nitric oxide, which is really important for these patients, for the brain and the inflammation and the immune system.
Beets. Nitric oxide is also, I've
Yeah, or just
noticed.
eat beets.
I was going to
Yeah.
say, well, it's gotten a lot of literature lately. I'm seeing more and more on nitric oxide, the importance of improving our nitric oxide. So that's cool.
Yeah. So everything I just mentioned is going to support the nitric oxide pathways and the microcirculation. And then there's a number of herbs and supplements that also do it, but those are things that you can do without supplements.
Okay. Which is great for a lot of people. Obviously budget's very important, or they've been struggling with this for a while and it has affected their job,
Mm-hmm.
or their partner's job, and so budget is a concern. If they can find it just in the grocery store or in their kitchen, and DIY it that way to feel better, I'm a
Mm-hmm.
bit huge fan. I think that's wonderful. If they can avoid the foods that are going to flare the histamine, but eat the foods that are going to improve nitric oxide and greens and support the gut.
Mm-hmm.
Buy ginger is very cheap. Ginger root is very cheap in the store. Buying ginger. And actually I do want to say this point. Ginger root tea that you make yourself, as opposed to somebody who says, oh, I have tea bags of ginger root. It's not quite the same.
Yeah.
You think it is,
Not going
it's
to be the
not
same.
the same.
That's
Yep.
right. Yeah.
Go buy that root, grate it up or chop it small and
Mm-hmm.
boiling water. Okay. All
Yeah.
right. Before we wrap up, did I miss any big categories that you have on your list people need to know about?
Um, no, I mean, as far as how we approach it, I think we covered pretty much everything. I guess the only two other things I would mention would be iron and the mitochondria.
Oh, yeah, of
So you
course.
just, a lot of these patients, their ferritin, their iron stores have dropped in long COVID. And so
Which
eating,
makes sense if you're constantly fighting something. Well, one, it could be anemia of chronic disease, right? And two, if you're fighting
Mhm,
something, doesn't the body the things like if you have bad pathogens, they can use iron themselves. They can swipe it from you.
mhm. That's right, exactly. Initially, their ferritin will skyrocket, which is a
Mm-hmm.
sign of inflammation, but then it will tank over time. And if you have low ferritin, low iron stores, your metabolism is going to struggle, your immune system is going to struggle, you're just not going to feel as good. So you want to talk to your doctor about getting your iron checked. And taking vitamin C is going to improve iron levels, but then you can just eat more iron rich foods like bison and grass fed beef and lamb and dark meats. All of those are going to have the most bioavailable form of iron.
Amazing. Okay. And then mitochondria.
Yeah, so the mitochondria, these are the energy producing parts of the cells, and the fasting is really going to help mitochondria. And then your diet, which should be the obvious, staying off of processed carbohydrates, sugar, things like that. That's very stressful to the mitochondria. And there are, a number of supplements that support mitochondrial health. Some of them, we already talked about. Even just supporting glutathione is going to be helpful
Mm-hmm.
for the mitochondria. The adrenal adaptogens will be helpful for the mitochondria. Medicinal mushrooms can be helpful for the mitochondria. But that's another thing to be aware of and talk to your doctor about.
And can you explain medicinal mushrooms so they don't necessarily think you're talking about hallucinogenics?
Yeah. So basically, like cordyceps and reishi and shiitake, turkey tail, maitake, all those are some of the lion's mane. Those are some of the big uh, medicinal mushrooms, and these help to balance the immune system and restore the immune system. And they support the mitochondria, anti-inflammatory. They help glutathione, they're antioxidant, anti-inflammatory, And so that would be a good thing to talk to your doctor about supplementing with.
And I want to, since we've been talking about supplements a lot, I do want to make the plug, quality counts. If you're buying mushrooms, like if you see at a store, like, oh, look at this, medicinal mushrooms, there's all the things that Dr. Nik said. But it's fly by night. It's covered in mold. You just don't realize it. It's the same for tea. If you're buying the cheapest green tea in these plastic little bags, tea bags, just know you don't know that that's green tea. It's likely covered in mold and sprays and herbicides and whatnot. And the plastic tea bag that you've just put in boiling water is now leaching out microplastics. So do the best you can, but do know that quality counts, and the cheapest, while it might fit in your budget, it may actually end up hurting your health. And we don't want that.
Yes, that's a really good point.
Yeah. Yeah. Because you've made excellent discussion today on the different topics and supplements and categories and things. And so if people are and should take their health into their own hands for a lot of it, in talking with their practitioner or researching it themselves, but I also just don't want them buying crap, because then you'll just get crap and feel like crap. So let's not do that.
Yeah, very good point. There are the studies on over-the-counter supplements do show that these are highly variable in their content. Some of them don't have anything at all in the capsule, and then some of them have excessive levels beyond what is healthy. So make sure you're buying good quality.
Yeah, agreed. All right. So given that this is the Root Cause Medicine podcast, we've been talking about long COVID. You've made several amazing just suggestions, literature points, clinical pearls, but give us your top 2 or 3 things you want to close this out with and have people remember.
Right. Yes. Top 2 or 3 things is, number one, I would say the social aspect of getting well, I think, is actually going to be very important. Like I said, even if it's just one friend you can spend regular time with, getting out of the house, walking in nature, being around healthy people, being around people you like that are healthy and supportive. If you need to, counseling is going to be really important. So that would be definitely a top one. And then the second one would be, I would say the fasting that we talked about is really going to help a lot. So figure out what works for you as far as an intermittent fasting schedule. And then number 3, I would say the vagus nerve stuff we talked about, all those things you can do that are pleasurable. The vagus nerve, no doubt, is one of the major impacted parts of this long COVID. And so anything you can do to stimulate the vagus nerve will give you big results.
So after listening to this, everybody needs to go gargle water, go hum, go sing your favorite song, belt it out.
Right.
Be with your community. I love this. Dr. Nik and his amazing podcast voice. Where can people find you? Where can they learn more from you? Where can they listen to your podcast?
Yeah, so my practice website is drhedberg.com, drhedberg.com. And the podcast is called Functional Medicine Research. It is geared mainly towards practitioners. And then the Hedberg Institute is hedberginstitute.com, and that's the online functional medicine training platform for practitioners. And if there are any practitioners listening, you can go to hedberginstitute.com and click on the webinars course. And I made a coupon code. It's Carrie Jones. And so if you use the coupon code Carrie Jones, you get that webinars course for free. And that's a monthly webinar series I do on a lot of different topics that would be helpful, like long COVID, Epstein-Barr, things like that.
That's amazing. And to make sure everybody spells it right, it's Hedberg. Hedberg.
Yes. Yeah. That's
Hedberg. Amazing. Thank you so much for being on today. I always enjoy talking with you, and I think everyone listening has just learned so much more about long COVID that they're not finding maybe from their acute care walk-in clinics or their primary care. So I think you've made a world of difference for a lot of us. Thank you.
Well, thanks, Carrie, for having me on. I appreciate it. I always really love talking to you.